Next, we have Dr. Tharini. And do we have the next, Dr. Gogote is there? Right. Please.
Good morning, everyone. My study is about comparison of generative artificial intelligence versus text-only learning ophthalmology, text-only learning among medical students. These are my disclosures. So as we all know, artificial intelligence is revolutionizing the whole medical field, and it is going to revolutionize medical education also. It can transform the traditional teaching methods. So AI-based educational tools can improve the learning experience in an interactive way. They can tailor the contents according to the individual needs of each student, whether they are better in learning or something like that, and reduce the time spent on each topic. So medical education also requires more visual and clinical skills. So the simulation capabilities of artificial intelligence can be used in such scenarios. The advantages of using ChatGPT and other large language models include increased knowledge retention, improved comprehension, and better satisfaction by the learner. Still, the contents of AI have to need to evolve more to replace the traditional textbooks. So the purpose of my study is to compare whether AI-based learning with the traditional text-only learning. The primary objective was to compare the effectiveness between the AI-based group and the traditional text-only learning group among the third-year medical students. And my secondary objective was to assess and compare the following parameters like post-learning assessment scores, time taken to learn the topic, ease of learning, wholesomeness of available information, and reproducibility of the learned material after 1 month. So this was a prospective non-randomized study conducted among third-year undergraduate medical students. So this was my study protocol. I divided the third-year medical colleges. Third-year medical students were assigned into two groups. So one group were given only textbooks to learn the topics. Other group was given ChatGPT to learn the topic. The contents of ChatGPT were verified by two ophthalmologists. We gave 4 selected ophthalmology topics were given, one each week. We had a pre-examination assessment. The scores were assessed, and after the learning phase, post-learning assessment was done. We had measurements for each topic. Primary outcomes were pre-examination score, post-learning score, and time taken to learn. And the secondary outcomes were ease of learning and wholesomeness of information. The reproducibility of the topic was tested after 1 month. These were my statistical tests. So we had totally 156 participants included in the study, and there was the mean age was 21 years with a female preponderance. Already there were 1 or 2 students were using textbooks and online resources for their routine study hours. So when we compared the scores, the pre-learning score was similar between the two groups. The post-learning score was slightly better in the ChatGPT group. The time taken to learn the topics in the ChatGPT group was much lesser. They took only 14.9 minutes on average to read the topic. The mean scores at 1 month assessment was found to be higher in the ChatGPT group. We found that ease of learning was also higher in the ChatGPT group. Wholesomeness of information, we found that it was similar between both the groups. So this was my result summary. So we found that the learning time was 42.5% reduced, and it was statistically significant in the ChatGPT group. Their post-learning scores was also statistically significant in the ChatGPT group. Ease of learning was also higher, 22% higher in the ChatGPT group. So there are some previous studies. In China, they conducted a web-based electronic survey saying that students are using more of AI chatbots. 91.05% are using already. They're using AI chatbots for quick access of knowledge and information. Another study in China has used a specialized ChatGPT tool that has showed that students have higher self-directed learning scores and better critical thinking scores using this ChatGPT tool. In India, we have done a qualitative survey for students using large language models. It has re-emphasized the ease of access, ready reference for clarity of doubts, lucid explanation of questions, and time-saving aspects. So the strength of my study is that I've used a novel artificial intelligence for medical education in ophthalmology. We have used both qualitative and quantitative measures to provide a comprehensive evaluation, and 1 month follow-up assessment is useful in assessing the knowledge retention of the students. The limitation of my study is that it is a non-randomized design. We have used only a smaller sample size. Ease of learning, wholesomeness of information, they rely on subjective self-assessment. So to conclude, the key advantages of using large language models like ChatGPT-4 in medical education is that we have improved learning outcomes, increased efficiency like shorter learning time and higher ease of learning, and enhanced student experience. We need to do multi-center randomized trials to validate the findings across multiple specialties. Thank you.
If I may ask a question. Are you aware of AI hallucination? What is
Yeah.
AI hallucination?
It gives wrong contents, wrong information about the
Yes,
topic.
yes. So that is the major limitation when
Yes,
you are
ma'am.
using chatbots and all for your.
Yes, ma'am. We verified the contents. Yet, whatever we do in ChatGPT has to be verified before
Yes. So it
producing
is
it to
still
the
in its
students.
nascent stage in medical
Yes,
education as
yes, ma'am.
such.
It has.